So we've now clicked start on our care pathway and we're going to start answering the questions for our MUST assessment. So step 1, MUST assessment. Does the patient have a weight recorded in the last 24 hours? And the system has looked for a weight, found there's not one there, so has pre-ticked no for us. So let's go down to the second question. Can the patient be weighed? Yes. If we click on no here, it will take you to a different sort of assessment here rather than the usual MUST assessment. It will ask you to do a MUAC instead. But if we go back and click on yes, we can now do our MUST assessment going to step 1A. So click on the blue link again. Please remember to click on the link, not around the link. So this will open the MUST assessment power form. And we now have to go down and answer the questions. But let me just draw your attention to the top. So if you're doing a MUST assessment and you've weighed the patient and got the information you need and had to go off and do another task, you can actually change the time and date when you actually measured the patient. So you've got several options here for have you weighed your patient? Have they agreed to be weighed? Has the patient declined? Unable to weigh patient? Or is there a best interest decision? And each one of these options will open a separate part of the form. So if we click on best interest decision, for example, if you're working in critical care and your patient is sedated, it will open the reason for best interest decision that you can weigh your patient and take you down there. If you're unable to weigh your patient, you can then do an estimated weight and height and an estimated weight loss. And also you can do the same if the patient declines as well. But however, our patient has agreed to be weighed, so we can tick into that box. And we're going to enter our patient's height in centimetres and the weight in kilograms. And we're going to say that our patient has lost weight in the last 3 to 6 months. So we're going to put a weight in there. And now the question, we can see now that the body mass index has been pre-populated with an answer, so it's calculated that for you, and also calculated the percentage weight lost at 7.1%. So we are now answering, was the weight loss planned or expected? For example, if this is resolved edema, planned diet, acidic drain, etc. And we're going to say no, the weight loss wasn't planned. And you can see it is already populated for us the next two boxes. So it's showing that the BMI score is over 20 and the weight loss score is between 5 and 10%, which matches the calculations above. Then we come to the acute disease effect score. And we've got a question of, is the patient not acutely unwell or a patient acutely unwell and no nutritional intake for over 5 days? Now, we know that our patients are in for a reason, so they are unwell in some way. However, we've given you some examples about not being acutely unwell. So we need to think about this question relating to nutrition and MUST. So the examples that we've got here are if they've been nil by mouth for over 24 hours, if they've got a feeding tube, or if they've been fed using feed, if they've had major surgery or they've got severe infection, sepsis, if they've got a gastrointestinal disease, if they've come in with severe diarrhea, vomiting or malabsorption, liver disease, acute pancreatitis, or if they've got a skin pressure ulcer and poor nutritional intake. Now, this is not a complete list, but please think of what is actually your patient is being admitted for and whether they tick into these boxes. But I'm going to tick that this patient is acutely unwell. As you can see, it's now calculated that we've got a MUST score of 3. So I'm happy that we've completed this form, but just one more thing to show you is that we have got some guidance on here as well, is how the MUST score is in guidance, how the MUST score has been completed, and some tips and tricks within this as well. There we go. So you can see that it shows you if a patient has a must of 0, they tend to be in a green pathway. Amber, if it's a greater or equal to 1 and greater to equal to 2. And at the bottom, you can see you've got lots of other choices there of what you can do to encourage extra calorie intake and what else you can do for your patients. But I'm going to happy that I have completed the assessment. I've got a tick, and I'm happy that I have weighed the patient at this time. So I'm going to click on the green tick and go back to my care pathway. So going now back to step 1B, only click here when you've completed and signed the form above, which I have. So I'm going to click into the box. And now it asks you further questions about your patient's condition. Could the patient be constipated, nauseous, or have loose stools? Now, if I clicked yes for this, it asks you what actions you've taken. Have you escalated it to your clinical team? Or I've already escalated it if you're doing a must and the symptoms have continued. If there's no actions needed at this time, and you can put more information within that other free text box there. But our patient has not got these symptoms. I'm going to click on no. And then it asks if you are concerned with swallowing or dysphagic symptoms. Now I'm going to click on no here, but if you click on yes, it does not come up with any more questions for you. It just adds this answer to the assessment decision. I'm going to click on no. And as you can see now, we've now got our step 2A assessment decision. And just like it said on the form, it shows that we've got a must score of equal to or greater than 2, which puts us on a red power plan. So our patient is at risk of when it comes to regards to nutrition. So now let's follow the steps again. Go to step 2B, treatment options to the right of the screen to order the power plan. So I've gone to treatment options, order the power plan below. So you're looking for the pizza icon. Click into that box and then click into the basket to the right hand side. Click on sign, which will order your power plan.